Councillor Izzi Seccombe, who is Chair of the LGA Community and Wellbeing Board. We have Dr. Amanda Doyle, Chief Clinical Officer of NHS Blackpool CCG. Liz Butler is here, Chair of Lewisham and Greenwich NHS Trust. And you have heard him spoken about a fair few times already, but let's meet the man himself. Sir Howard Bernstein, Chief Executive of Manchester City Council, and also, it's fair to say, one of those architects of this idea of devolution. A very warm welcome to you.
Got me too.
You can sit here as well.
Yeah, sorry.
Wherever you like.
Say a few words. Well, firstly, can I, on behalf of Manchester, wish you a great welcome, your conference here in this great city, and can also thank you for the token of respect which you showed just now, not only for the people who were killed in that horrific incident the other day, but also what happened here 20 years ago. What I'm just going to do is spend a few minutes, I think, and talk a little bit about two or three things. One, the Greater Manchester, it's not just the Greater Manchester story, because I think to understand that story, I think is very important in creating the context for many of the conversations you're going to have today and throughout your conference. Secondly, identify what I see as some of the key drivers in the whole public sector reform and growth conversations, a little bit about devolution, and even less about where I think we are, certainly where health social care. So first of all, the GM story. Greater Manchester has had a history of joint working which spans well over 20 years, certainly from the mid-80s. And I think it is very, very important to recognise that that history of joint working has to be related to not just how 10 individual local authorities work together in order to drive a very distinctive economic and social policy which has led to a whole range of clear priorities, but also how we have developed through that single functional geography focus the most clearest and the most effective platforms for collaboration across public sector partners. So when you talk about Greater Manchester, when you talk about health, social care, devolution, you can't just think of what's happened in Manchester over the last 18 months. You've got to look and see what's happened over a significant period of time. Why is that an important part of our DNA? Well, we recognise that if we're going to become or remain a world-class city, productive as well as economically competitive, and we've got to compete in that global marketplace, then how we actually organise ourselves, how we actually focus increasingly on an integrated approach to economic and social policy, reforming public services, is absolutely a prerequisite for change. So that's in our DNA, that's been a key focus for our approach for some time. What are the key drivers? We passionately believe in the democratic accountability of individual institutions. We work very, very hard, but we work very hard with a focus on place. We put people and place before organisations. Myself as Chief Executive of Manchester, my other colleagues as Chief Executives of the 9 other local authorities in Greater Manchester are not just Chief Executives of organisations. We see ourselves as exercising a leadership role, working across sectors in our own individual localities, driving place-based priorities. That's absolutely essential, because unless you drive place-based priorities, you're not actually focusing on people, which is absolutely fundamental. So for us, collaboration across sectors is absolutely key to effecting change, and also is the requirement to rethink what we mean by accountabilities so that we underpin the place-based approach. Why is that important? Well, as one little anecdote really, 7 or 8 years ago, when all of us started to face the impacts associated with the changes in fiscal requirements. Some would say, if Richard Lees was here, they'd say very significant cutbacks in public spending, particularly local government spending. Greater Manchester was seeing something like 22 to 23 billion pounds of public spend each year spent in 2007. Notwithstanding all the reductions in public spending, particularly local government spending today, we are still seeing 22, 23 billion pounds of public spend. So we are not cutting the structural deficit in places like Greater Manchester, and if we're not cutting the structural deficit in places like Greater Manchester, we're certainly not doing it in our other big city region. So the key to financial sustainability is actually a place-based approach to the way in which we spend our budget. That's one of the key doors through which we've been able to unlock around the whole devolution agenda. It's not just about growth, it's not just about how you make places economically competitive, it's also a real focus about how you make places economically productive. And we know in Greater Manchester and many, many other examples in other parts of the country that there are serious levels, not just of worklessness, but also serious levels of labour market participation, which needs to be significantly improved. And we all know, don't we? We all recognise, because we see it on the front line day by day, that the inability to join up public services effectively means not only are people within NHS or social care establishments where they shouldn't be necessarily, they're not in work, they're actually not playing a full and active part in our labour market. So for us, when we address the whole question of devolution, what we addressed very specifically was not just the traditional functions around planning, around housing, around transport, which everyone would normally associate with the growth agenda. We also placed health, social care, early years, health and work at the heart of our overall strategy. And I think over the last 12, 18 months, we've actually seen significant progress right across the board. I want to pay tribute to not just the leadership of many of my colleagues in local government, but also the leadership that has been exemplified right throughout the NHS and wider health social care sector in Greater Manchester. At all levels, people who have recognised the requirement for change, people who have also recognised the importance of focusing on place, people who are giving time and energy and commitment in order to develop not just 10 locality plans which are focused around how we introduce single commissioning foci around individual localities, initially based around health social care spend, yes, but increasingly over the next 12 18 months and beyond on the wider public services. We want to see single commissioning hubs for all public services developed within all our locality to ensure that when we talk about early intervention, when we talk about early help, when we talk about the type and quality of public services that the people of this conurbation, and I suspect in other places in this country require, we are going to be able to deliver the outcomes that are necessary. Where health and social care is concerned, we are particularly looking at what we describe as the double devolution. Just bringing powers or functions or resources down from the centre to locality level by itself is not going to deliver all the change that's required. We are also starting to rethink our relationship with the people who live and work in localities. We're actually increasingly looking at them as assets, looking at how we invest in public services, not looking at them simply as models of financial deficits, which I think has become too much of the norm in the way in which public services have been addressed for far too long. So in the way in which we engage the people of Manchester and how my colleagues engage their residents in other parts of Greater Manchester, we're actually addressing their real needs, listening to their real needs, and in return for the services and support we can offer on an integrated basis, asking them to also take more responsibility for their own wealth, well-being. So on health and social care, we've seen new governance arrangements a collaborative approach to partnership and leadership. This is not about local government being in control. I can assure you that's not the case. This is about a distributed leadership process where commissioners work alongside providers, working alongside local authorities, both at GM and at individual, the Cllr level, driving forward priorities, driving forward change. Unprecedented, we have seen all our providers establish a federation where, for the first time, we are seeing not just collaboration, but also majority decision-making foci being developed. We have a strategic plan. That strategic plan was approved by all 37 stakeholders. That was the key to a financial settlement on the back of the spending review of last autumn and the creation of a transformation fund, which we are now in the process of administering, and we are now in the process of actually starting to spend serious money, but only on proposals which actually genuinely have the potential to transform the system. And it's in that way where we are changing the accountabilities away from organisations focusing on place. One final point from me. When we talk about the devolution lens, we tend to just look at public services, picking up one of the points which Stephen raised in his address earlier. We're also looking at what we mean by health and social care being at the heart of our academic science system here in Manchester. We've got great assets. We have, however, a rather fragmented, that's not a thing which is unusual, of course, when we talk about health, social care. We have a rather fragmented system of governance. We're changing that. We are creating, through Health Innovation Manchester, a single platform for collaboration between our universities, our great hospitals, our great commissioning teams, and more importantly, our industrial partners as well. So Manchester will not just be synonymous with the development of new healthcare and integrated social care and NHS models. It will become increasingly associated with the wider growth agenda, which is so important to transform our economy. Thank you very much indeed.
Have a seat, join us. So this is, oh no, don't run away. I've got a question. You're right in the middle of the Northern Powerhouse. You've been doing this for decades, this idea of place-based policy and cooperation. And you also have 450 million from George Osborne, who's called this the proudest deal he's ever done in his time. You're quite a unique example. How do you relate this to other people's experience who may not be so much in the headlights of favour and attention as Manchester is?
Well, it doesn't feel like we're favourites or you know, I think you've got to recognise that, you know, we've worked bloody hard to get where we are today, and there's still a hell of a long way to go. You know, as I was trying to say at the start of this process, this wasn't just Richard, Howard, a few local authority leaders doing some sort of cosy arrangement with a Conservative Chancellor of the Exchequer. You know, nothing could be further from the truth. There is a requirement to rebalance our national economy. Most people would recognise that for many, many years. There is a requirement to reform our public services. There is a requirement to devolve power. And what we've been able to do, working with our health colleagues, working with public sector colleagues in Greater Manchester, and crucially with business, is develop a narrative, an evidential base, and at the same time underpin that with a capacity for consistent delivery.
I'm not doubting for a second that it hasn't been hard work at all, but what I am suggesting to you is that you have, by your own admission, been doing it for years, for decades, in fact. So you are way down a track that people are just now getting onto in other places in the country. And you all of you have this 2020 milestone to reach. How realistic is it to expect others who are just now embarking on this experience to get there by 2020?
I think it's up to them, if I'm being frank with you. You know, 2-3 years ago, we established a model of governance called the Combined Authority. We were the first local authority in the country, or series of local authorities that did that. there are now 3 or 4 or 5 combined authorities. We have to start to create incentives. We have to start to create frameworks which encourage individual places to develop their own structures, to work to their own priorities, and to develop the capacity to deliver. And I think there is plenty of evidence around the country that we're seeing significant progress.
Well, let me ask the rest of the panel about this, because we have a wealth of experience. And just to remind you, from right to left, who we have here with us, Councillor Izzi Seccombe is chair of the LGA's Community and Wellbeing Board. We have Dr. Amanda Doyle with us as Chief Clinical Officer at NHS Blackpool CCG, and Liz Butler, chair of Lewisham and Greenwich NHS Trust. Izzi Seccombe, first of all. In the last year, I hosted an event for a social care event. And I was struck by the complete depression that seemed to be reflected from those people who were there, who look up at the NHS with their ring-fenced budget like hungry children with their noses pressed up against the glass of a sweet shop. And they feel cut to the bone, and they are expecting even further cuts. Now for this kind of thing to work, you're going to need a marrying of minds. How do you marry minds that are feeling starved and in pain with those of the people out here who have a job to do by 2020?
Absolutely understand that, and we've been through this for actually not just the last 3 years, but the last 5 years in local government, trying to do more with less. And arguably one of the challenges for us is that we cannot set a deficit budget, so we've always had to try to, as Stephen mentioned earlier, we do have to match the spend. The spend has to match the income. I think the really exciting thing for me is actually out of those challenges, you often find invention. You often find good practice, and arguably, here am I today. This is the first time the LGA have been present at this NHS Confederation event, which is a fantastic achievement. We are launching a joint document here, which is really important, again, about how we are going to do more with less. But more importantly, I think what we have to do is, why are we doing this? It is about trying to deliver better opportunities for people to access good health care, good social care, and to be more involved in their own pathways to it. So I think there is a real opportunity here for us as a partnership to work together. We have produced a document together, and there are many demonstrations already of good practice going on. It is not easy. I don't think any one of us knows a quick panacea to all of this, but there is good practice going on. There will be more practice. We have a 2020 goal ahead of us. I think this document will help, and we're moving to the LGA conference in 2 weeks' time, and we'll be launching a backup document to it, which is a toolkit of actually how can we then get into this set of different relationships. But relationships are at the heart of it. There has to be an element of trust, of bringing together. You have to find time to be with each other, to work on the agenda that you've both come to,
so
and to understand the evidence.
So the message that was coming across loud and clear from the social care sector was, we don't have time to do what we've got to do already.
Yeah.
We don't have time to finish what's in our in tray at the end of the day. So, go away with your requests for doing more and changing the way that we work and changing the way that the people in our constituencies think.
And in brief on that, I think where I see it, I think we have actually got, we need to have a goal. We need to actually push forward and be ambitious and grab the nettle and make those decisions with our partners. And there is a sense of urgency about it, because we've actually had 60, 70 years of having systems that are vertical, and we now need to start becoming horizontal and getting people together. It's right, because it's actually what people want. It's what I would want in the system. I don't want to be part of being passed from pillar to post. I want that to wrap around me and make something that works. And I think we can do this. There is already evidence of this, of good practice working. In some of the best health and well-being boards, you've got some really strong relationships. The STP is a business model that I believe that will set up the agenda of how can you financially and constructively work together. But you need the health and well-being boards to front up, go out and to sell this as a partnership of equals. We need to share those risks. We need to understand the governance that is a challenge for all of us, because it's not just about me putting my hand up and saying my governance is more important than your governance. We have to understand that we have a system that needs to come together, and we need to be sharing these responsibilities and risks.
So Amanda Doyle, just talk me through the way in which you get people on board, because we are talking about, as the STP, these 44 STPs are effectively going to be chiefs of disparate tribes who have dug in and are entrenched and loyal to a certain colour and have been for many decades, and now they are being asked to unweave that rainbow and reweave themselves into something different. How do you bring them on board, providers in particular, CCGs in particular, who have been fiefdoms in their own right?
Well, that's the challenge, and what's abundantly clear is we can't just keep doing what we do now. We've got to do it differently, and we've got to move rapidly to scale up so that we can deliver across those much bigger footprints. It takes a different approach. It takes a different way of working with our partners, with our patients and communities, local authorities, not just social care, but housing and transport and infrastructure. We've got to play to the strengths of those teams. It's going to take a different sort of leadership. So the leadership we need for an STP has got to be collaborative, it's got to be honest and open and transparent. An STP lead has no formal authority. So I've got 4 children, and when they were younger I used to quite like going to work because I got to sit down and everybody did what I told them when I got there. Being an STP lead feels a lot more like bringing up the children. So they don't actually take a blind bit of notice of what you say, but the best you can do is have a strong relationship and communicate well and model the behaviours that you want them to behave and create an environment in which they will flourish. And you're doing it because you care passionately about the outcome and not for reward. And it's much more like that. It's not the old top-down sort of behaviours. And these are complex systems. And that's how we need to think. We need to think about systems and not about our own organisations.
See, what I always love about these conferences is the candour of people. So, they don't take a blind bit of notice. You're not going to hear anyone who is an STP saying that, by the way, but that is interesting to hear. It does, though, as much as anybody says this is not a top-down hierarchical system, if you draw it on a piece of paper, where I was trying, I'm not of your world, so I was trying to understand your world. And to me, the way that I sketched it out was you have Simon Stevens, who does the think work, you have Jim Mackey now, who does the muscle work, and you have the 44 STPs who have to do everything else with everybody else. Now, how do you sell this to everybody in each of these people's constituency that it isn't top-down, when it looks and smells and feels to many like a top-down pyramid?
Oh, that's a good one to start with. I think that if we try to sell the STP as a concept locally, people would look blank and not understand. I think where we're working in Lewisham is talking about the Lewisham pound, making that more valuable. And it's working together in a system to resolve things. I think where we are in South East London, it is sensitive because we've been there a few times before. I think the trick with this will be the relationships, and it's building those, the trust and the links so that we actually achieve something, and building with tangibles, not theories. I think at the moment we're still very much at the planning stage. And to an extent, we don't want to frighten the horses too soon. I think it's when we start to actually engage with people and work out what the tactics are for delivery rather than the top-level planning. That's when we will get the momentum.
See, Lewisham is such a fascinating experience, and what would be good to know is what you have learned from what happened in Lewisham, because that was a place where a lot of ill feeling was generated, and we saw demonstrations out almost every other day to save the A&E department at Lewisham. If you have somebody telling others what to do, even if you tell them this is place-based, but telling them what they have to do by a certain time, how do you do that without creating the ill will that Lewisham felt very keenly over the last few years?
I'll challenge you on the ill will, because actually it was the opposite of ill will. It was a huge movement of people who wanted to support something and oppose a plan that was poorly thought through. So it's sensitised our local population, and any change, any movement will have to be convincing. So the stakes are higher for the people who will be selling plans, because actually we've got a highly articulate, motivated, very supportive population. So it's not ill will, and it's not a war zone. It's people who genuinely care. I think the challenge will be that plans have to be given enough time to be challenged, and that's the real difficulty with pace. And taking just a little bit longer and testing things properly, letting people argue, actually is very healthy. And I hope we will get enough time to be able to do that.
Okay, Howard.
I think the conversation really needs to be looked at in the context of what's happening now. You know, you've got lots of very senior, good leaders, public services who currently are presiding over a failed system. Notwithstanding the amount of resource that's been invested, particularly in health social care over the last decade, in places like this, population health outcomes have got worse. So we are dealing here with a system which has to change if we are going to create the outcomes which all of us who are involved in public services in this part of the world want to deliver. So the starting point is not to say, well, is there a case for the business as usual approach, because that's clearly not an option for anybody. So the next set of issues is how do you actually create...
Okay, so how do you? Let's talk about concrete. So we had that one example of social care reeling from cuts that others are not feeling to the same extent. How have you managed to bring people on board that way?
What you've got to do is look at things differently. Our strategy is about how we reduce the demand for high dependency services. So where social care is concerned, what is the balance between what we do as a Greater Manchester Authority and what we do as 1 or 10 times in our case is very, very important. What is the balance between investment in community settings rather investment in residential establishments? How we pool our resources, which we're trying to do now in Greater Manchester, how we join up. Something like £3 billion or thereabouts is going to be subject to joint commissioning arrangements in Greater Manchester this year, which is unprecedented. So we're not going to solve it overnight, but what we have to do is create the partnership structures, the locality plans, the foci, which gives us a chance of becoming financially self-sustainable in 5 years.
Well, it's really interesting because both of you have touched on time. So you said at the last answer that you gave that I really hope we're given the time to do this. How much time is enough time?
Instant fixes aren't possible. And I think a 5-year window is credible. But we need to start the footprint and the enablers to actually let us move forward. And I think those enablers, they're hard to get tied up, but then you get momentum behind it. So we have spent years building up an integrated IT system so that the partners can talk to each other in Lewisham. But now we've got it there, adding the blocks on is actually relatively, and I say relatively, straightforward. So we're hoping mental health will now link into us as well. We've got social services, GPs and the hospital linked. That's an enormous enabler, but you take years to get that through the planning and the procurement and the installation and the training and all of those things. So if we were starting now, I'd be worried. But in fact, a lot of this we started a long time ago, and we're capitalising on it now.
Anyone else worried about the time limits that have been set?
Absolutely, because some of what we need to do is really radical. We need big change. particularly around the way we configure hospital services, the way we develop integrated, strong out-of-hospital services, and those things take a long time to do. So we need to be getting on with that before the financial gap continues to widen and overtakes our ability to deliver. But we also need to make sure that the environment we've created to do it in is enabling. So we need to continue the work we've got about whole population budgets, look at multi-year settlements, reform the tariff. We need regulation that is system-based regulation. We need assurance that is appropriate and sensible. We need the system to support improvement rather than just give people a good kicking if they're missing targets. We need national support for some of what we've got to take will be really difficult decisions over the next couple of years, and we need the support to be able to do that.
See what it sounds like to me then, and this is a phrase that politicians use all the time, that the milestone of 2020 is more aspiration than deadline. Am I right in saying that?
That there is undoubtedly some complexity in it. I'm very envious of Howard, who within this footprint, they have decided to create a transformation fund themselves, which will really help it. And it's certainly something that we've argued for at the LGA and will continue to argue for, because, you know, double running is a much more simple way of trying to resolve the future proofing, as well as actually delivering the services that we know at the moment. But you're absolutely right. What we have got, you know, there's going to need a different type of workforce for the future, and we need time to develop that.
How much time do you need?
Well, people need to go through a college system, through a learning system, and, you know, arguably you could say there's a 5-year program here. But that said, I think there are some wins that we can deliver now. Part of this is going to be predicated on the fact that localism is a really important word that we need to bring forward. Now, in my world of local government and in the clinical commissioning world, actually localism is what we do. We have a footprint that we work to. Arguably, I think the big model of the NHS works to a national system and is evaluated on a national system. So we need to have some flexibility and change within that, that is going to adapt to doing something that actually meets local needs and even people needs, but as well as having a national overview, a strategic picture.
See, I mean, that very important document that you brought out a while ago, this collaboration, it does have a date on it. It has 2020. Now that's...
It does.
And you just said you need at least 5 years. How... I'm trying to reconcile those two things. You signed your name to this,
Absolutely.
but you're saying that actually it doesn't give you enough time.
But I have to say, I believe in timescales, because I think unless you have something that you work to, slippage happens. You know, it happens in the world of local government. It always does, and I just believe that, you know, it's about getting people to the table, allowing those time frames for you to build those relationships. That doesn't have to take long.
Okay.
It really doesn't, but you do need to trust, and you need to believe that other people have got just as much right to be there as you have.
I'm very happy to take questions for this fantastic and very candid panel. If you'd like to put your hands up, once again, the Batmen and Batwomen roam among you and they'll find you. Just a question for all of you. There is a school of thought that says, actually, this is a very good way for ministers to buck pass. That if they create you in your newly ring-fenced local places, things go wrong, they can just shrug and say, yeah, don't look at me, they did it. And so accountability kind of gets compromised because of that, because you can't, you know, as Tony Benn's very famous phrase goes, you can't vote the buggers out because we didn't vote you in to begin with. And second of all, it's not their fault. There's too much political shrugging that will be facilitated by just leaving you all to it.
I think it's more direct, actually, the accountable relationships, because, you know, you've got, you know, local councils are elected every 4 years. It's more visible leadership, more direct leadership, and fundamentally, yes, we will have to observe, honour, respect all the key priorities of the NHS. Why wouldn't we when we do that, of course. But equally, there's a very simple choice for individual places here. We just sit and pretending there's a business as usual approach and have it done to us. And I think if we needed any justification or about what happens when the centre does things to you, I think we can see over the last 20 years we've got very precious little right where health social care is concerned, it seems to me. And therefore, it is important for all our local leaders of NHS as well as local authorities commissioners to take more active responsibility for shaping their own destiny. That's a course we've certainly determined in Greater Manchester, and I've never heard any leader of NHS, local authorities or anyone demur from that basic principle ever since.
We're going to take questions from the floor. Anyone else want to come back on accountability?
I think it's just important. It's not just buck passing, but blame passing. Yeah. When things are really, really difficult, the easiest option often seems to be to pass the blame on to somebody else. But if we sit here for the next 3 years saying CCGs are just too small and too naive and too rubbish, and providers are just too money grabbing, and local authorities just don't commission enough social care, or we'd all be all right, we won't be any further on in 2 or 3 years' time. It's really, really important that we accept responsibility and step up to the mark as a system, that we stop passing problems between ourselves and find ways to pay less or to charge more. We've only saved £1 if none of us have to spend it. And unless we get quickly on to stepping up and radically changing the way we deliver things, we haven't got 5 years. We won't be sustainable in 5 years.
Let's take some questions. Let's go to number 5, first of all. The slowest relay race in history. Hello.
I'm Ian Smith from Four Seasons Healthcare. You know, the consequences of poor integration between health and social care are getting worse by the day. Bed blocking, the slow motion collapse of local authority funded care homes and domiciliary care sectors, and too many, especially frail older people living with dementia, being poorly cared for in the community. I'd be interested in hearing from the panel, what are the practical steps on the ground that they think need to be taken to overcome these problems?
Okay, I'm going to take 2 or 3 questions together and then we'll get responses from the panel. Okay, number 3, yes.
Yeah, a similar question. This is about system leadership, and it's about the top-down approach that we've seen from Manchester, which is going to be reflected in our STP programs. And I'm wondering how you allow the bottom-up and how you engage the workforce and how engaged you feel the workforce are in your plans.
Okay, actually, let's just take those 2 because they're related, and then we'll come to that question. Izzi, do you want to take it first?
Yes, I'll go with the last one first, the top-down to bottom-up. I'm a great believer in the bottom-up, actually, I have to say, because I think that's back to the world I come from. You know, my local community is enormously important to me. I believe they know their own communities. They can be part of this voluntary sector that helps to wrap around how we keep people independent in their own homes for longer. And it isn't, you know, I take my own mother, and actually she didn't want to be part of a system. She wanted the life that she chose to have. And if that can be helped by a localism approach, then that is what we should be doing. We should be trying to adapt to that. So I think
does anyone on the panel actually want to sort of show specifics of where, very concrete, so our friend, the first question, gave very concrete examples of problems that are being faced right here and now, bed blocking being one of them. so concrete steps that you can address that problem when you have one partner in that marriage, the social care partner in that marriage, just on an unequal footing, if you like.
So we haven't cracked it, without a doubt. We've still a lot to do, but what we have done in Lewisham is very much co-locate staff, social services, district nursing as teams, and using the IT interface we've built so that they can talk to each other. We have joint commissioning of all children's services together. So again, it's one service co-located, working without real worries about what the badge says, is what the job is. And we're working towards redefining some of the roles. That's actually harder, but it will get us there as well.
Okay, thank you. We've got two more questions. Let's take these
Can I
two.
answer the question here about?
Yes, okay, very briefly, Howard, if you will. Yeah.
Okay, well, it's certainly not top-down. It's both top-down and bottom-up. You have to have both. And I think you'll see in remarkable amounts of evidence of the way in which individual localities are actually working together, working not just with traditional institutions, the third sector, engagement with residents in the way in which those locality plans, 10 individual locality plans in Greater Manchester, are being developed.
Thank you, Howard. Number one first, please.
My name's Anton Sanaya. I'm an acute physician in Greater Manchester. We've heard about timescales and how we have to really move at pace. I'd just like to ask a question about Healthier Together and why it was that the Association of Greater Manchester Authorities effectively stopped clinicians making tough decisions, particularly about A&E or A&Es, as well as women and children's services in this region.
Okay, thank you very much. That's a specific question for you, Howard, I think. And number four.
Hamish Lang, I'm a medical director in NHS Wales. I'd be very interested to hear how you see these partnerships being able to address some of the wider determinants of health, for example, housing, digital exclusion, those sort of things.
Right, so little time, but such big questions. Let's start, Howard, very briefly, if you could answer the acute physicians question. Healthier Together, what happened there?
Well, I genuinely don't recognise the circumstances that have been described there. That might be my fault, but that's certainly didn't happen in Manchester. There's other people shaking their heads as well at that point. I think the issue around public service, we have got to move to a single integrated commissioning hub for all localities, for all public services. So it won't just be health, social care, public health. It will also be children's services. It will also be housing services in particular, because it's only in that way, in my view, by developing particular integrated hubs that we're going to be able to focus on the particular and real priorities for people in their neighbourhoods.
Yeah, and I'll just bring Izzi in then on the NHS Wales question, because then it's an exponential remit. If you're looking at housing, and then you're looking at, arguably transport to get people to and from work, and their quality of life and their strain that they're put under.
All of it very important, and all of it parts that actually demonstrate to me exactly why we should be joining together to help to deliver a better, a more streamlined service to people, because these are the issues that we deal with daily, and there are challenges in local government. I live in two-tier world. We've got upper-tier authorities doing one, and we don't do housing. However, it is absolutely imperative that at your Health and Wellbeing Board, you have everybody sitting there, because you create the communities that work for the future. You create where your housing's going to be, so it's along a bus route. So it actually has got parks for that healthy older lifestyle that we've got, that you've got communications. So maybe the social worker, or maybe the joint social and health worker of the future, actually takes the digital access to the client, to the patient, whoever it is. But we need to support people, and innovation and changing IT and technology can help.
Well, we have got a very interesting IT seminar coming up. I think it's tomorrow, which will be fascinating. And also our American speaker, who is the head of Medicaid, will be able to talk a little bit about what they've done in New York, which is this kind of stone in the pool kind of approach to health in New York. Amanda, you wanted to very quickly come in
just very quickly. Talking about health and wellbeing boards and scaling up the prevention aspects and the infrastructure stuff, it's really important that we look at the footprints we're now working on and try to reflect those arrangements. So the STP that I lead, we have 4 upper tier authorities, 4 health and wellbeing boards. We have a paper going through the local authorities which they have agreed to move to a single health and wellbeing board across the whole footprint and reflect that in a single scrutiny arrangement. Those are the sort of relatively simple but often hard to do things which enable you to move quite speedily through the process of change. Those are the sorts of things that can take ages to sort out, so it's really, really important that you align those. Don't underestimate the importance of that digital infrastructure. So locally we were doing some great stuff around remote consultations, swallowing assessments via Skype in care homes. The single biggest problem we had to solve was that the care homes didn't have wireless. We didn't have rapid broadband. You can't do remote consultations without it. So some of that infrastructure is really, really vital, and getting a governance set up that reflects the footprint that you're trying to deliver over really, really helps you to move forward.
Well, thank you all very much indeed. What an interesting start to what I think is going to be a very important conference this year. Could you all please join with me in thanking Sir Howard Bernstein, Councillor Izzi Seccombe, Dr. Amanda Doyle and Liz Butler. So now is the time for you to break out and run free. There's a very exciting exhibition out there. There are some breakout sessions out there. And we'd like to also thank the partners for the NHS Confederation Conference, Allocate Software, EMIS Health and Optum, as well as media partners. And our first charity partner this year, Elias Dunlos Support UK. Thank you very much.